Okay, so one of the first things that I'm going to get out of my bag, believe it or not, is a good old-fashioned pen. So, safety first, so I'll put my gloves on. This is just a permanent Sharpie, and what I'm going to do is I'm going to write down what time I arrived, 12:15. Right, just write it on my glove as I take observations of the patient. So, hello, can you hear me? So this is our level of consciousness. That's our AVPU, alert, verbal, painful and unresponsive. Hello, can you hear me? Yeah, how are you? If there are any bystanders, the best information you can get is someone telling you what happened. Hello, my name's Billy. I was just walking down the street and this guy got hit by a car. He's gone right over the top of the car. That big bullseye on the car windscreen is where he hit his head. He says he's fine. He wanted to walk away and I insisted that he needed to, I needed to call the ambulance. Whatever the story is, bystanders will give you that information, and that's a brilliant starting point. You can write all that sort of stuff down, brief history. So when we arrived at 12:15, he was alert. Later at 12:30 he only responded to verbal prompts. Billy, can you open your eyes for me? 15 minutes after that he would only respond to pain. I would squeeze his fingertips, squeeze his ear. I'll show you a little trick as to a discreet method of only response to pain in a moment. And then at 12:45 we're still waiting for the ambulance to arrive and he is unresponsive, right? So get in the habit of writing stuff down. If it turns into a serious anything, it's highly likely you'll have to stand up in court and explain what you did. That doesn't mean you have a liability, it just means that it's serious, you know. So have that in the back of your mind when the ambulance arrives. Your history, your handover, what you've done to the patient should pretty much instantaneously alert them to the fact that this patient is getting better or this patient is getting worse. If at 12:15 they were conscious, alert, responsive, it's now 12:30 and they are unresponsive. Their condition is getting worse and we already know that. So instead of maybe a stay and play situation, this is a load and go situation. Get them on the ambulance and the ambulance starts to move because they are seriously injured. It doesn't mean it's going to tear away on blue lights, it just means we need to be moving towards a hospital, a centre of excellence, and medical interventions will be done on the way. But this basic, what time did I arrive, what were they like when I first turned up on scene, that's all really, really important stuff. Okay, I'll start by opening this kind of front pouch on my pack. In here I've got a couple of 40% oxygen masks. I'll get you some close-ups of all of this. Decent torch, because these things never happen on beautiful sunny days. It's always in the middle of the night when it's pouring with rain. I've got a pouch. The pouch basically, you know, unfortunately in the 21st century, you know, we've got to have chargers for things. I've got to have spare batteries for the torch. So that's just a little bag of kind of electrical resupply type items. I've got a first aid manual. Again, I'll give you a close-up of this little book. But even for me, you know, I had 20 years in pre-hospital care and operated at quite a high level. But I like this little book. This little book, I think for me, is a little bit more useful than the St John's Ambulance first aid manual, because it's just simpler, it's easier to digest, it's smaller, it's got some really sort of funky stuff in it. It gives me a remind and revise. You know, if I'm somewhere doing a first aid on-set medic or something like that for television and film, I drag it out and have a little thumb through it and I get a remind and revise. It tells me about legislation, you know, the Health and Safety at Work Act, all that sort of stuff that like I say, if you get a serious injury or incident, people are going to want to know about. They're going to ask you questions. They're going to say, what was this, what was that, blah, 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 blah. So I guess in the 21st century, we've got to be writing stuff down, right? So that's the front pouch of my medical kit. On this side, I have a big pot of wet wipes, and these are really handy if you get on scene and there's body fluids, so maybe there's blood, there's urine, there's vomit. Very difficult to see what on earth's going on. So what I normally do is just pull half a dozen of these out, because I've got a big kind of swab in my hand, and I'll just wipe away whatever it is, and I can actually see what's going on. Be careful, obviously these wipes are disinfectant wipes. You can use other types. I use this for cleaning my kit and equipment as well. So it's the old, isn't it? If you put something in your bag and it does 2 or 3 things, that's a good thing, that's a good piece of kit. These wet wipes are very similar. Always have those readily available to hand. On the other side of my first aid bag, I've put together an ambulance pouch. So this pouch, again, I'll bring you in, give you a close-up of it. So in my pouch I've got a seatbelt cutter. I just use that for really unzipping clothing on the patient. So I'll take like the hem of a trouser and just zip up the seam, open the trouser up, and suddenly you can see the limb. I've got a window punch. It's just access to motor vehicles. Won't elaborate on that, but just Google it. Decent pair of trauma shears. I've got a kind of first aid dressing pair of scissors. Got metal forceps, and I've got a whistle, a pair of tweezers, decent pair of steel tweezers. Sometimes for, you know, taking out maybe pieces of glass or something like that from an injury before you dress it. Obviously, if you leave piece of glass laying on the surface of a wound and you dress it, you put direct pressure on it, you know, it hurts, you know. So we can just pick obvious pieces of debris out of a wound before we dress it. The whistle and the torch are absolute kind of paramount things to have immediately to hand if you're going to be serious about first aid. So I always have a little torch in my pocket, and of course if you're going to have a little torch, you've got to have a spare battery for it. I guarantee that any complicated first aid type scenario will happen in the dark, in the pouring rain, and the one thing that you're going to want to do almost immediately is kind of get people to help you. The easiest way to do that is to start flashing your torch and start blowing your whistle, and instantly people will start to look at you. As soon as people start to look at you, you can gesture, you know, help me, come here, help me, right? And this kit is paramount to have immediately to hand as soon as you commit to scene and start to get your kit out. So that's my ambulance pouch. That's on the outside of my bag. I've got my wet wipes. I'm going to clean the area and have a good idea of what I'm looking at. But I haven't even opened my bag yet. Tips and tricks. This is stuff that I've found really useful over 20 years on the front line.